Hello, everyone. Welcome to our low back pain webinar with Dr. Dan East. I hope that you are all okay during this lockdown. It is certainly, I know that we at Total Balance are finding it quite a tricky time, and my family personally, I think everyone is. So I really hope that you're okay. The reason we're doing these webinars is to, I guess, lockdown inspired, try and give as much back as we can. We find that you as a community are so very generous to us, so we would love to give back, particularly in these times of need. So today, our second webinar, last month was Gut Health with Sally. This month it is Low Back Pain with Dr. Dan East. So I'd love you to meet Dan. If you haven't met him already, he's one of our osteopaths here at Total Balance. He has, hi Dan. He has a Bachelor of Science in Human Structure and Function. He also has his osteopathic qualification, which is a Bachelor of Clinical Science and a Masters of Health Science. And he's also a sessional anatomy tutor at Victoria University at the moment, which is absolutely brilliant. So Dan, so glad to have you here sharing everything.
Nice to see you all.
And not just low back pain, it's going to be a bit more than low back pain, just back pain in general.
We'll cover a few things in general, yeah. But I'm sorry if I'm a little bit dark on the screen, but we're a bit gloomy today where we are. So we'll push on.
Let's go.
Let's go for it.
All right, so what Dan will be covering today, he's going to go through the pain experience, managing acute back pain. I'm going through posture and your back pain as well. Disc injury is one of my favorite topics. And should you get an X-ray and MRI, another one of my most favorite questions. Let's cover that one. The psychological influences of your back pain, which I think is really dominant at the moment and a really pressing issue that we need to cover. And the importance of exercise.
Very good. Well, let's kick it off, shall we? Yeah. So we've got a bit to cover. Beck, do you want to take us through the shout out and how that will work?
Yeah. So we do have a lot to cover. If you have any questions at all, please put them in the chat box, because we do want to make this as practical as possible for you and answer your questions. That's the whole point of this as well. And if we can't get to them, we will cover this in the podcast as well and share that with you as well. You'll get this recording. You're going to get the bonuses at the end. So please ask any questions that you like so we can tailor it to you as best that we can. If we're moving too fast, talking too fast, please let us know.
That is awesome. Cool. Let's get into it. So I thought we could start today by going through some really common myths about back pain, because I think that is pretty much where this webinar stems from, I suppose, is just try to dispel a few of those kind of things. And what we've got here is a bit of a list of things that we see all the time in the clinic or hear from patients all the time in the clinic. And it can be really difficult to kind of try and use our language to, well, I suppose, solve those mysteries or solve those myths. But yeah, it's really prominent in the community, I suppose, these kind of, thoughts and ideas around pain. So I'll quickly run through them, but we'll go through each one in a bit more detail throughout today. So back pain indicates that there's serious tissue damage. An increase in back pain means that more tissue damage is occurring. That's obviously very common. So if you're getting more pain, you're thinking, God, what's happening? More damage occurring, and that can lead to more pain in general, which is interesting, but we'll get into that. Wear and tear and its relation to exercise and loading. Getting an MRI and finding out the cause of my pain. That's something that we'll cover today. I have a bulging disc in my back, so I will always have back pain. That is something I hear probably every couple of days, I reckon, in the clinic, and not necessarily true. So we'll get into that later on as well. My back is out of alignment and needs to be put back in. It's also very common. And then surgery is the best option for my long-term pain. And hopefully throughout today, we'll answer all of those and dispel all of those. We'll identify those as we come through the presentation. So we're going to start with the pain experience. So what causes our back pain and how does this kind of direct our intervention or what we can do about this kind of back pain experience. So I just wanted to start with a few causes of low back pain. So if you're on the actual link, you can pop into the comment box if you like, if you can think of any causes of low back pain, because there's quite a few. But generally we think of causes of low back pain as, primarily injury related or tissue damage related. So as I was saying before, you might get a disc herniation, a disc bulge, any kind of muscle strain. You might get some ligament damage in there as well. And this is generally your first thought when you think about what could be a cause of low back pain or what the cause of your low back pain is. And most back pain does generally involve initial site of injury or initial onset of injury. You might be lifting or bending or something one day, and then all of a sudden it pops up. But then that can kind of come out of that early onset of pain and then develop into something a bit more chronic. So then all of a sudden 6 months, 12 months, 3 years, 5 years down the track, you've still got quite a bit of pain. So flashing up the causes of low back pain, we've got heaps. I mean, there's anything really can affect your back pain, and doesn't necessarily have to be related to tissue damage to be causing pain. So I think that really plays into what we were just saying before about if you're feeling like you're in a lot of pain, doesn't necessarily mean that there's more back pain, more tissue damage occurring. It means that there's a lot of these other factors most likely that'll be playing into the pain experience for you. And we'll get into those specifically in a sec. I just wanted to bring up this quote by Lorimer Moseley. Lorimer Moseley is a very famous neuroscientist, pain neuroscientist, that does some really awesome work about how pain is perceived in the body, or how it's, I suppose, modulated in the body as well. So pain is modulated by any evidence that implies danger. It is just your brain's opinion of what's going on in your body. So I wanted to set up today by really thinking about the concept of back pain being, multifactorial, I suppose. There's a lot of different things that can influence it. And it's not necessarily just tissue damage that is, the main determinant of your pain. And as I said, it can be that to start with. But as we move through the months or years of chronic low back pain, it's not necessarily what's causing it. Generally, with a painful stimulus, you get, if you're, walking through the forest one day or something like that, and you, scratch your leg on a twig or something, you might feel like you'll get a stimulus through the leg. That signal will be sent back up into the spinal cord and then into the brain to be perceived as pain. So once it's into the brain, all the different parts of the brain will basically interact to be able to decide whether or not this stimulus, or whatever has hit your leg, is dangerous to you. And then if it decides, yep, it's danger, need to avoid, it'll send pain signals to that area. And that's how the painful response comes about, essentially. And that whole process can be really infiltrated by different things like fear or stress or fatigue or anything like that. So, if you, for example, Lorimer Moseley usually uses the point where you might have done that one day, you get a bit of a scratch from a twig, and then the next time you do it, you might see, get the same thing. Your brain decides it's not dangerous at all, but then you look down and there's a snake that's been biting you. All of a sudden, the threat goes up, the fear response goes up, the pain level, even if it was the exact same kind of tissue damage, would be through the roof, because you think, a snake is involved, that's scary, I'm in danger, bang, and that whole process will really flare up. So that's a bit of a convoluted way of talking about pain, but it's definitely just opening the door to thinking about pain being, determined or influenced by a lot of different factors rather than just tissue damage. Another point he often makes is talking about like stepping on Lego. Stepping on Lego is really, really painful, but there's not really much tissue damage at all. So whatever the threat there is, it can change your experience with it as well. So yeah, true or false. This is just gets our head thinking about what pain might be like or what the experience is like. So a professional pianist and an elite marathon runner both cut their finger when preparing dinner. They're likely to both experience the same amounts of pain. What do we think? You can pop that into the chat box if you like. True or false? It's pretty straightforward after what we were just talking about.
I think this is a really, really good one. I think of this in terms of AFL footy players and their recovery
Yes,
from injury.
exactly. Yes.
Yeah.
Yeah, we see it a lot with elite sports or people that really need their back to move. But I mean, it can be linked to, you know, everyday people as well, people that are moving about.
So we've got some falses here.
Yes, a couple of falses. Thank you, Nicole. Yeah, so false is definitely correct. So a professional pianist and elite marathon runner both getting the same amount of tissue damage to their hand. It's likely to have very different experiences for both of them. And the reason there, the professional pianist is much more likely to have an increased pain response because they'll think of their hands as, you know, really important for their livelihood. You know, there may be that threat of not being able to play the piano for a particular period of time. There may be the threat of a loss of income if that's what their income is based on, a return from injury, rehabbing, all that kind of thing. Whereas a marathon runner could probably run with a cut finger with absolutely no dramas. So that's a good example of just thinking about the same amount of tissue damage or same kind of pain being experienced really differently from different people. So I think, yeah, coming back to those causes, that probably gives these other causes around here a little bit more credence. And we really start to get a little bit more of that multifactorial picture behind back pain rather than just, you know, the tissue damage that's occurring. And that's what comes back to when you're saying, you know, I've got a disc bulge, this is going to definitely cause me pain. It can definitely be influenced by a lot of different things rather than just the tissue damage itself, which I thought was an important note to make. So there we go. First, straight off the bat, we've got a couple of the back pain myths that we can basically eradicate now. So back pain indicates that there is serious tissue damage. That's certainly not always the case. There can be really minute tissue damage or no tissue damage at all. And there's just other factors that are influencing that pain experience for us. And then an increase in back pain means that more tissue damage is occurring. Certainly not the case either. You know, increase in back pain may be that we're more stressed or we've had less sleep or more fatigued, or if we go back to all these different causes, you may have been at work for longer, you know, sitting for longer, your smoking may have increased due to stress, you may be more anxious. That's certainly happening a lot at the moment. So yeah, just wanted to open your eyes to a lot of different factors of back pain rather than just the tissue damage itself. Hurt does not equal harm is a really good thing that I like to, you know, tell my patients a lot of the time. So this will come in a little bit later in the lecture as well, but in terms of exercising, that's really important as well. So when you start to do new activities and those kind of things, you really want to avoid avoiding things because of pain, because it doesn't always equal harm. And sometimes we just need to push through that first little barrier. We'll get into that a little bit later. So what can we do about it? So obviously we've spoken about pain being multifactorial, and that really means that our intervention needs to be the same. So this is a little meme which I thought was pretty amusing. We made this for our Instagram page actually, but it hasn't been put up yet, but we'll put it up in the coming days. Low back pain patients, so really skipping all those different factors that we really try and get our patients to do. So education about their back pain, you know, some strengthening and exercise and all those kind of things, getting your 8 hours of sleep, reducing your stress, alcohol intake, nutrition, all these kind of things. Unfortunately, with chronic pain in particular, chronic low back pain, just whipping out the massage gun every couple of days won't really do you justice. You know, it might help for 5 minutes, it might release a little bit of muscle tension, but we really need to focus on all these different factors that may be influencing the pain, such as your sleep, such as your diet, such as your exercise, to really give us a bit more of a broad-based intervention rather than just, you know, whipping out the massage gun, or that can be replaced by anything really. There's not generally a real quick fix with these kind of things, and thinking about a lot of the different factors is really important. The good news with most back pain, it lasts an average of 6 weeks with or without intervention. Now, obviously, intervention will certainly help advance that time, or might, improve your experience through that 6 weeks. But research suggests that most last that period of time. Most cases of back pain aren't caused by serious pathology, and then surgery is rarely required. And that's something that we'll touch on a little bit later in today as well. So that is the good news. So it's important to keep those things in the back of your mind, especially if you do get an acute flare-up of pain. When to get checked out. So there are certainly some red flaggy type things, some symptoms that you need to really be aware of if you are getting really bad back pain. And these certainly need to be sought. You need to seek urgent care, from your health professional, doctor, specialist, whatever, if you're getting any of these kind of symptoms. So the inability to, pass urine or lose bowel control, that's certainly important, something you need to really seek urgent medical care for. Noticing changes in sensation in the saddle region. So the saddle region, if you can imagine, is the skin that you would sit on the saddle of a horse. So in that kind of groin area, if you're losing any sensation in that area, it's really important to seek urgent care as well. And then some other ones, excessive night pain and sweating. And then if your symptoms increase significantly despite your best efforts and despite treatment, that's when to get checked out. So outside of those factors, there's obviously some things that can also indicate, worse pathology or worse pain, but these are your main ones. So I just wanted to touch on how to manage acute back pain. So acute back pain essentially is back pain that lasts less than 6 weeks. And we all, well, most of us have had it. 80% of Australians suffer from low back pain at some point in their life. So acute back pain is generally where you get a bit of a flare up, you get that really intense muscle spasm. You might get some symptoms coming down the leg. You may feel really, stiff and sore, particularly in the morning, or if you're not walking around. So what do we do in that case? First of all, it's normal to be really frustrated with yourself. I definitely know if I get a bit of a flare up, get really annoyed and think, oh, I should have done this, shouldn't have done that, blah, blah, blah. I should have, strengthened my core or something or other. But that's not really helpful in that position. I think, it's easier said than done. It's easy for me to sit here and say that. And, when you're in a very acute episode, you may think differently, but it's really important to remain calm and stay positive, because that really helps your outcomes, especially in those first couple of weeks. And try to avoid catastrophizing pain. So that's really thinking about the worst case scenario, which is something that we could pretty much do in general at the moment, not just with pain, I think. But we really need to harp on staying positive and just, calming yourself down when it does happen. These are the main modalities that I like to talk about with my patients, and something that you probably all would have done before. Maybe in different kind of realms, I suppose, but the big thing of heat pack or ice is something I get asked a lot about in the clinic, and research suggests that both are pretty effective, both are about the same amount of effectiveness. It generally comes down to personal preference with heat or ice for me. A lot of people will say, that heat really works for them, or even a mix of heat and ice really work for them, which is great. But there's no conclusive evidence that say one over the other. So pick what you want to go for and just stick with that. Generally, I recommend using it for about 10 or 15 minutes. And then if you can, every kind of 3 or 4 hours, but that will obviously depend on, what you're doing at the time as well. Some anti-inflammatory medications can be really helpful in that early stage of an acute flare-up. But obviously they're only going to provide temporary relief, so you don't want to rely on them too heavily, and should always speak to your pharmacist about taking medications as well if you're unsure. Obviously, if you're pregnant, or if you're taking other medications, or if you've had liver or digestive issues as well, that's certainly a consideration. So you really need to be mindful of what you are taking. But and obviously, I always have to say it, but do not take medication which has been prescribed to others. You would be amazed at how many people say, oh, I just took so-and-so because we had it, from someone's post-surgery or something like that. It's never a good idea. You never know what it's going to be mixed with, or, what your contraindications or how it's going to react in your body. So just be careful doing that. Creams are really popular, obviously, with people getting some massage or anything like that into their back after an acute flare-up. Magnesium cream, and Beck shouldn't be too humble in this, but she makes the best magnesium cream going around. Really good for anti-inflammatory properties, and really good as like a bit of a muscle relaxant as well. And then there's other massage gels like your Tiger Balm, Physio Cream, all those kind of ones. But the idea of creams essentially is we want to be able to reduce a bit of muscle tension to increase your movement, increase your natural movement. So you shouldn't think about it as a really passive option. You don't want to just take magnesium cream and be done with it and just lie on the couch all day, because that will really flare you up a little bit more. And then hydrating is really important, and something that a lot of my patients hadn't really considered as well in that kind of acute back pain. So drinking your 2 liters a day can really help reduce inflammation and really help in that early stage. And avoiding bed rest is the #1 tip. If there's one thing you take out of today, try to avoid bed rest when you are in an acute episode of back pain. You'll all remember Grandpa Joe from Willy Wonka, potentially. He, I think he was in bed for 20 years or something, so no wonder he couldn't move when he got up. But this is certainly what will happen with acute back pain. It used to be a really popular treatment protocol, where if you hurt your back, you'd be told, 4 or 5 days or even up to 2 weeks, just bed rest and really let those muscles settle. It's not going to be what happens. Really see that, people lying on the couch all day, lying in bed all day with a sore back, the muscles really stiffen up and get neglected a little bit, I suppose. So they, you've reduced your mobility in the back and hips. That really leads to poorer outcomes as well. So it can lead to a little bit more increased pain. So generally, I recommend, try and move about 30 to 40 minutes every from different positions. And of course, you need relative rest, right? You don't want to go out and run a marathon after you've just hurt your back. You're definitely allowed to sit down or lie down, but just try to limit it to about 30 minutes at a time. And just cycling through different positions can be really helpful. Cool. So disc injuries. I wanted to put this in because it's a really major, point of contention, I suppose, with a lot of people, as we're saying a couple of those myths before, but also it's super common, disc injuries. So I wanted to quickly talk through that. To get a bit of an idea on disc injuries, you've kind of got to appreciate what a disc is. So it's these blue parts here in between segments of the spine. So the vertebra there are the bony parts, the blue bits there are the discs, and you can see them along the spine on the image on the left. And they're basically to provide a little bit of support to the spine and its natural function, but also to shock absorb. So they take a lot of the pressure as you're, lifting or bending or walking or whatever. But they also increase our flexibility of the spine as well. This image in the middle is just looking at it from a top view. So when you do get a bit of a disc bulge, you may see on this right side, that's a really bad example of one, but it can bulge out and hit this yellow structure here, which is a nerve that can come down into the leg. And that's why generally with a disc bulge, you'll get symptoms coming down on one side into the leg. And this can be, the cause of back pain, spasm of the back muscles, sciatica, which you may be aware of, which are those kind of pain shooting symptoms coming down the leg, or some numbness or tingling. It can cause muscle weakness and numbness in the foot or in the leg or foot as well. So that's super common. The lower segments of the spine, these two here, are more susceptible to this kind of injury because they have a lot of compression and a lot of force going through them. Here are a couple of back pain myths that I want to just dispel though. I have a bulging disc in my back, so I will always have back pain. First of all, most bulging discs will heal on their own within 6 months, which I know is a long period of time, especially if you've got that really acute pain that's really painful. But it's good to have that kind of time frame in your mind. And look, a lot of them, you know, your pain experience may last a lot longer than 6 months if you don't take care of those other factors that we were talking about earlier. But research has suggested that the actual bulging disc itself, the tissue, will heal within that time frame. So certainly not the case that you will always have back pain if that occurs. And strengthening and exercise and all those kind of things can really help it, but we'll get into that in a sec. Also, my back is out of alignment, needs to be put back in. If we go back to this image before, you'll see those discs, they're in there pretty snugly. There's bony structures around. You've got a lot of ligaments and tendons that sit around the disc as well. They are not going anywhere. So when you feel like you might be a little bit out of alignment, or the disc is like moving at all, it's certainly not. It fits really firmly within the spine. You can get, you know, niggles and those kind of things with inflammation, and that can kind of feel like it might be lopsided, making you lopsided or feeling like a little bit out of alignment. But it's certainly nothing is moving in your back, which I think is really important to think about. Cool. So that's halfway through. So we're just open to a bit of a shout out. If you've got any questions at the moment, please pop them in the comment box. I'd be more than happy to answer anything that you've got so far. We may be moving a little bit quick.
No, I think we're going really well, Dan, because some of this theory can be boring, but it's so important to understand it, to empower you, to help you with your back pain. It gets you such better results if you understand the why, which is I guess, the whole crux of why we're doing the webinars.
Well, that's right. And we see obviously with a lot of patients, education is certainly important in their outcomes. So we've just got a question, just touch on the slip disc bit. Yep, no dramas. So back to what we were saying before, the slip disc is something that we really hear a lot about in the clinic. So, and this may have come from language that you may have heard from a health practitioner in the past as well. So, you know, we used to think, you know, back in the day that they did move around a little bit, or that can kind of cause that pain or misalignment. But the discs themselves are really snugly fit right into the spine. They're really robust and strong. And they're tied in there with ligaments and tendons and muscles and cartilage as well, which is joined to the bone. So they're certainly not moving anywhere. So I think if you're thinking about them kind of slipping or moving, sometimes it can feel like that if you're getting a bit of an aggravation in the back, but they're certainly not moving anywhere.
I hope that answers your question. Yeah. In that their discs don't slip, they bulge in a bad incident. So I remember my mum had a slip disc. So what did she have? So that would have been the terminology that was used by that practitioner back in that time. It
would have been the language used, yeah. So a slip disc essentially was the language, I should have probably covered that, that was used for a disc bulge. So if we go back one sec, if we go back here to this image, see how you can see there's a little bit of that disc moving out and pushing onto the yellow part, the nerve there. I'm not sure if you can see my pointer, can you, Beck? Yep. Yep, so that is basically, where do we go? So that is what a disc herniation is, where a disc bulges out a little bit, but it's certainly not the disc slipping anywhere. It's just a little bit of indentation of the outside of that disc and pushing into a nerve. So certainly, yeah, something that we used to use in terms of language, it was the slip disc. But I think that's not very helpful, because if you hear the term slip disc, you think about it moving everywhere and you know, falling out or something dramatic like that, and it's just not the case.
Definitely. And where you see that bulge where it's coming on out there to touch on that nerve, those layers of those cartilage knit together, they're like layers of the onion, don't they? Right. It was amazing. Mm-hmm. Yeah, as it repairs.
Yep. Awesome. Okay, shall we move on?
Yep, let's move on.
Alrighty. So posture and back pain. This is a really important one, especially with working from home. A lot of people are working from home at the moment. And you may see that desk, I look, this may just be me, maybe it's just me, but I look at a lot of different ergonomic, advice and little pamphlets and those kind of things, and think that there's so many different angles and everything going on. It's really hard to think about, which one to focus on. It can be a little bit confusing as to, which one may be causing pain. You might lift your chair up and then all of a sudden your knees or ankles or whatever are out of the, out of the angle that you want to be aiming for. So getting all of them together can be difficult. So what I wanted to do was just focus on the two basics. So these, when I'm talking to my back pain patients about posture, particularly desk posture, you really want to focus on these two main areas. So eyes being in the top line, in line with the top third of your screen. This is probably pushing it a little bit, yeah, but it's not too far off. And then hips should be at an angle greater than 90 degrees. So the easiest way that I think about both of these, firstly, eyes being in the top third of your computer screen is a pretty straightforward one. But you ideally want to have, if you're working at home in particular, you want to have your laptop maybe set up on a couple of books so that it can be lifted up to your eye line. And then hopefully you're able to use a separate mouse and keyboard, because that can really, if you're looking at a laptop all the time, you're basically diverting all your attention straight down to the table, and then your shoulders are up, your wrists are up, and it just kind of throws everything out a little bit. But yeah, if you can really lift that computer screen up a little bit and then get a separate mouse and keyboard, that can really help take advantage of that situation. And then the hips being at an angle greater than 90 degrees. So what I like to think about is you want your hips to be higher than the level of your knees. So whether that takes a bit of adjusting of your chair or table, or maybe both. We know that if your hips are a little bit lower than your knees and you're really compressing those hips, that can certainly cause a little bit of reduced mobility through the hip, and then subsequently can cause a little bit of back pain as well. So that's a really important one to get your head around as well. So those are my two main tips. Everything else are certainly important, and look, everything else are really important, particularly if you're getting other injuries like an elbow injury, shoulder injury, wrist injury, all those kind of things. But in terms of your back pain, if you're thinking about what to do with your desk at home, they're the two main ones that you want to think about. This might be a bit controversial, but there's no definitively bad posture. And this is something I speak about with my patients a lot as well. Because everyone comes in, I'm the same, I used to do the same, but comes in and says, oh, my posture is always really bad. I'm always really slumped. I'm doing this, doing that. And that's whether they're sleeping or sitting or standing or lying or whatever. No, there's no evidence to suggest that any particular posture is worse than another, but it's more about the static postures that we want to avoid. So static meaning that you'll be staying in that posture for a long period of time. And I think that's really important to think about. So obviously, if you're slumped forward, and your shoulders are really rounded, and those kind of positions can be a little bit more pain aggravating. But in terms of the damage that they're causing or anything like that, nothing really suggests that that is the case. But having said that, it's best to kind of cycle through a lot of different positions as much as possible. So whether that means, you go for a bit of a walk just to break up your work day, every kind of half an hour or so is ideal. Whether you've got a standing desk can be really helpful as well, just to break those up. But it's important to note that you can be just as lazy at a standing desk as you can at a sitting desk as well. And that comes back to those kind of static postures. We're just putting a lot of weight onto particular areas of the body. And if you're doing that for a long period of time in the one spot, that spot can result, I suppose. So that's really important. So the best posture is your next posture, is a good little tip that I've picked up along the way. That's just basically talking about, changing your posture every 30 minutes. I don't know if George Costanza rings any bells with anyone, but he had a little, he's from Seinfeld, by the way. He made a little bed under his desk and would nap every kind of 45 minutes or hour. And so ergonomically, he was actually on the ball. not so great work-mindedly, but yeah. Sleeping posture is certainly something that we talk about in the clinic a lot as well. And this can be really important, particularly with that acute low back pain when nothing feels comfortable. You've got a real flare up of that low back pain. But these are the two kind of positions that I generally recommend. So using a pillow in between your knees if you're side sleeping, or under the knees if you're sleeping on your back. And you really want to make sure of those pillow heights are correct as well. You don't really want to have the neck fleece. If the pillow is really massive or if the pillow is really thin, you don't want your head to be kind of bending sideways either, because that just affects the natural curvature of the spine. So we really want to be able to keep those parts in neutral. But yeah, certainly sleeping on your side, keeping a pillow between your knees just opens the hips up a little bit and opens the joints of the back up a little bit. And certainly, yeah, just can be great for that reduced pain levels, because sleep's obviously certainly important, and we really need that to help restore the body as well. So when you're in that pain cycle, sleep can be one of those main factors. And if you're not getting on top of that, yeah, that's going to be a bit of an issue. So how can stress influence your back pain? This is certainly something that we get asked a lot, and I kind of touched on it before about, pain being multifactorial. So stress is really important, and we're seeing it a lot actually in the clinic at the moment, unfortunately, with everything going on. But stress really plays a massive role in the pain experience, not just back pain, but pain itself. But certainly, obviously, very important with back pain in general as well. So here we've got, you may have seen maybe some year 10 biology or something. Is this is the rest and digest system or the fight or flight system? So this is basically our nervous system and how that operates. So the nervous system is really complex, and I won't get into it too much today. It's probably worthy of a whole another series of lectures, I would say. But essentially what it breaks down to is we've got two different parts of our nervous system, one being the rest and digest, which is a very calm system. You get a lot of blood flow to your organs and those kind of things to be able to digest your food, to sleep, to settle down. And then you've got another part of the nervous system as well, which is your fight or flight system, which is essentially keeps you really alert, really tenses everything up, your body's moving a little bit more. And we certainly need both of these systems. You'll see the fight or flight, obviously, if there's a snake chasing you, you need to really be alert and be active, and you need muscle, you need blood going to the muscles, all those kind of things to be able to get out of that situation. But then also we need a bit of a balance of the rest and digest as well. So sleeping and all those kind of things are really important. But in terms of a normal system, you essentially have a balance between these two. Now, what happens with that chronic pain cycle and long-term back pain, all those kind of things, and stress really feeds different chemicals into the body. So cortisol, adrenaline, all those kind of different hormones and chemicals. And Beck is really massive on this with her naturopathy work. But yeah, if you're getting a lot of cortisol and a lot of increase in that kind of fight or flight or sympathetic system, it really tenses everything up. Your muscles become tense. You're losing the ability to be able to switch off and on, or losing the ability to balance between those two systems. And as a result, the whole system can become quite tense and quite sensitive. And stress just basically pours into that whole sympathetic side. And inflammation can go up. As I said, your muscle tension can really rise as well. We know all of those things are linked with back pain as well. So in terms of thinking about stress, we really need to be on top of reducing that stress impact on our body and on our pain levels as well. These are some of my tips for reducing your own stress. So physical activity is a great stress reliever. I've really been harping on that with patients at the moment in lockdown, because they're not getting to their gyms or not doing their Pilates classes or whatever. And it's really, a great, chemical release with serotonin levels and dopamine and all those kind of things with physical activity that can help reduce our stress levels as well. Obviously, rest and sleep can really help reduce stress, but it can be a little bit of a cycle, right? So if you're really heavily stressed, then that can really affect those kind of things as well. So getting that balance is really important. Meditation and mindfulness is really, really awesome in terms of calming that system down, and reducing stress levels. And that doesn't mean you have to go and sit in a park on your own and closely meditate for 45 minutes humming along or anything like that. You can there's really simple strategies you can even jump on YouTube and just find some easy breathing exercises or, meditation and mindfulness exercises that are really helpful. And they can just be anything from kind of a minute a day just to start off with. And just calming that whole system down can be really important. Work-life balance is really important at the moment as well, especially. We really need to, we've been seeing a lot of patients getting stuck in, they might be working at their desk at home or at their kitchen table at home, and really trying to avoid, they're getting mixed up, I suppose, with the barrier between work and life at the moment. They're really trying to get away from their desk, but they're feeling like they're always there working, and not getting much stimulation outside of work as well. So just ensuring that you're kind of putting that time away to get a bit of balance there is really important. And then reducing social media time, certainly something that we could probably all do a little bit as well, especially with everything going on. You want to just kind of distract yourself from things in the world sometimes. Okay. Should I get an X-ray or MRI? This is something that we always get asked. Okay, so what I've got here, I need to get an MRI to find out what is causing my pain. So that is one of the main back pain myths that we always hear. Not necessarily. Here's my first answer to that. First of all, most back pain can be diagnosed without any imaging whatsoever. So we've seen a lot of stuff over the years. You get a really good sense of symptoms of things, causes of things, and you really get a good clinical, I suppose, appreciation of what these kind of injuries look like, without having to send off for like a super expensive MRI. Like MRIs can be upwards of $300, $400. So it's a really expensive way to find out something that we likely already know. So that's the first part of that answer, is that it's super expensive and we don't really need it because we can diagnose without it. But also secondarily to that, the actual scans themselves can show things that don't necessarily correlate with your pain and may not be causing any pain at all. And it becomes a bit of a red herring, that you may follow down the loop and it just isn't a cause of pain. You hear stories of patients that had particular disc bulges or damage to the spine that have gone off and got surgery to fix these things, and they're still getting the pain. Well, how could that be if that's what the cause of pain is? So we really need to be careful about picking things out on a scan like an X-ray or an MRI, and saying that's conclusively what is causing my pain, because it's just not normally the case. This little graph here is really interesting. I picked up from the Physio-Based Medicine Facebook page, which are really good for a lot of these kind of things, and just shows how common disc bulges are on a population. Now, this is actually an asymptomatic population. So that means that these people are getting absolutely no pain at all. And these little points down the bottom, are the age. So 20-year-old, 30-year-old, 40-year-old, 50, 60, 70. And then at the top, we've got the percentage of those particular patients that have a disc bulge on their MRI. So as you can see, as we get to 40 years old, 50% of 40-year-olds will have a disc bulge that would show up on their MRI. That's not necessarily causing pain, obviously, because this whole population, 50% of these 40-year-olds, all of these 40-year-olds don't have any back pain, but 50% of them have a disc bulge. So we know, judging by that disc bulges don't necessarily cause pain. And you can definitely see things on an image that, maybe a bit of the wrong idea, I suppose, because they'll normally link that with back pain, but it's not necessarily the cause. And that's really what comes back to what we were talking about at the start of today, about the multifactorial nature. And you may have had a disc bulge that could have caused pain initially, and you get that, pain from that acute episode. But then all those different factors kind of layer on top and really cloud that that pain experience, and can really, lead to it becoming a little bit more chronic. Exercise and pain. This is really, really a great topic. I love exercise. I love talking about it with my low back pain patients. And I think this is probably something that education is really important as well, because we know that, strengthening and exercise are really, really important for low back pain sufferers. But getting them, toes into the water and getting them through that first hurdle of, experiencing pain with movement or all those kind of things can be a little bit tricky to manage. So we're going to go through a couple of tips that we can talk about. First of all, another back pain myth: exercise and loading leads to wear and tear of my back, which will increase pain. This is something, we hear about all the time. Your body, you're not a car. You don't have parts that are made up, that are, only available for certain mileage that'll break down after a while. The human body is really adaptable. It's really good at self-healing. It's an amazing organism that can, just regenerate cells and do all those kind of things. So don't think about cartilages wearing down, or any tissue in the back really as wearing down if you're, going to be running or deadlifts are really going to squash my spine or anything like that. That certainly doesn't happen. In fact, benefits of exercise, as we've got here, all of the tissues around the low back actually really help or are helped by exercise, particularly resistance training. So bones get thicker, denser and stronger. Spinal discs, which is what we were talking about before, actually get thicker and more hydrated. I'm not sure if I mentioned before, but they're actually made of mostly water. So you want that hydration. And then increases in muscle mass, increases in tendon capacity, joint cartilage. They're all real benefits from doing repetitive exercise, not just a one-off, unfortunately. I think that's a really important point to make in terms of wear and tear, because it's really common to think that, doing these kind of activities, which we'll get into in a sec, will cause, thinning of the cartilage or more possibility for breakage of bones or anything like that. But it's actually quite the opposite of that. So what is the best exercise for chronic low back pain? Now, this is a point in the webinar where you want me to say, do these 2 exercises and you will be cured of your back pain. Unfortunately, it's not that simple. This seems a bit corny, but the best exercise for low back pain is the one that gets done consistently. So that's really about finding what works for you. And we'll go through a bit of a framework in a sec, but really finding something that you can get into your routine, that you'll be able to consistently do, and really get those benefits that we were just talking about before. And this probably leads to my point in that you see a lot of stuff on Instagram or social media in general or wherever, that people will claim like this one particular exercise will cure your back pain. That's really popular stuff, because I mean that sells, of course. Like, if you're looking at Instagram, you'll see, oh yeah, what are these 3 exercises that I can do for my low back, which is obviously really important and it's really good to do stretching or strengthening or whatever it is. But without an individual aspect of it, you can't possibly say that one particular exercise is going to cure everyone's low back pain. Some are better than others, but certainly not one. There's not one silver bullet there. So some of the ones that I like prescribing, and this is what we'll go through as part of the bonus features of today's webinar. I'll be sending everyone out a PhysiTrack program. PhysiTrack program is essentially like a list of about 10 or 12 exercises that we put together that can be really helpful for back pain. And it might give you a few ideas of what really works well for your back, and what you really enjoy doing. And then that can kind of, help lead into a bit more of a regular routine pattern or exercise pattern. So some strength exercises that I really like getting into people with low back pain are bridges, which you may have seen before, where you're lying on your back and bring your hips up. And any hamstring strengthening exercises, because they really take a bit of pressure off that low back as well. Some functional exercises are really, really important. So deadlifting, lunging, squatting. And that's probably something that a lot of chronic low back pain sufferers are really scared of getting back into, especially if they've hurt their back doing those kind of activities. But graded exposure, which means, gently getting into it and starting at a low back platform or base, and then just moving up weight or up reps or anything like that, can be really, really beneficial. And you can really get back to the things that you've been doing in the past. Core strengthening exercises, of course, are really important. They can really help brace your back. And we've got we've got all of those kind of things in the PhysiTrack program that we'll be sending out. Cardio is also really, really important for low back pain. So walking and running, swimming, cycling. Again, really think about those kind of aspects as not, thinning your cartilage or not really tearing or wearing your back down. But it really, hydrates the discs in the back and really strengthens the muscle, strengthens the bones. So it's really important. So a bit of a framework when you are trying new things, because I think this is a bit of a barrier for everyone, or most people that suffer from low back pain, is that when you do start to try new things, you will likely get a little bit of pain. And that's totally normal. And I don't want to invalidate that at all. But just using this framework can be really helpful in terms of starting new activities. So start with a pain scale. So 0 out of 10 pain, 0 out of 10 pain being no pain at all, 10 out of 10 pain being the worst pain you've ever experienced. So 1 out of, if you're doing a new exercise or a daily activity, so that could be mowing the lawn, it could be, doing push-ups, it could be anything. 1 to 4 out of 10, keep doing what you're doing. You might get a little bit of pain, but if it's only minor like that, certainly push through. 4 to 6 out of 10, you may want to start to proceed with a little bit of caution. You may need to modify things a little bit, slow down or speed up or whatever can kind of reduce a little bit of impact on the back. And then if you're getting the 7+ out of 10 pain, avoid this activity for now, but not forever. So it may just be a little bit too much for what your back can handle at that particular time. But as you kind of start different things and start to get a little bit of strength, it certainly doesn't mean that just because you've tried something and it's super painful for the first time, doesn't mean that that's done forever. And in fact, I really try and make goals with my patients to be able to get back to certain things as well. A bit of a caveat though, no matter what category that kind of pain is in terms of your exercise or daily activity, if your pain is significantly worse the next day, that is probably a bit of an indicator that you're doing a little bit too much. So you might just need to back it back a little bit. So even if you're only getting 2 or 3 pain at the time, but it's pulling up really badly, that's probably just, sensing that you need to just pull it back a little bit. And then you can kind of start to add those things back in as you get further down the track. And what about surgery? Surgery, well, this is the last myth. So surgery is the best option for my long-term pain. Most cases, evidence doesn't really support the use of surgery. So particularly for chronic low back pain. So if your doctor does suggest surgery as being the only option, you really need to ask questions of them and get a really informed opinion. So the questions you should probably ask are, do I really need this surgery? Are there other, low cost options or more effective options? What happens if I don't get the surgery? What are the costs involved? Those kind of questions that you really want to get an appreciation of from your specialist or GP or whoever's advising that before you kind of dive straight into anything. And look, it can happen. As I said, 90% of cases don't need surgery, even more than that, probably 90, 95 plus. But there are a couple of cases that will need that. But you just really want to go into that whole process being as informed as you can, rather than just following, one person's advice and just going into it blindly. So yeah, I think that's really important as well. Some final words. You need to make a change to get a change. Nothing is going to get better by doing nothing. So as I kind of alluded to before, often, with back pain, we're trying to find, that one exercise that'll just cure my back pain or that kind of thing. It's very rarely a quick fix like that, unfortunately. If it was a quick fix like that, we would be millionaires because we could just go and cure everyone's back pain straight off the bat. These things take time. They're difficult. They take lifestyle modifications. Go back to my slides earlier about the causes and the multifactorial nature of pain. That is where the bread is won, essentially. That is what you want to focus your time and energy into, and getting that more holistic and rounded approach to your intervention, because that's what needs to change to be able to, start to decrease that pain. Don't be upset with the results you didn't get don't be upset with the results you didn't get from the work you didn't do. That is probably a little bit brutal to finish on, but
I think it's very wise words.
I think it is really wise words. Yeah. All right, so introducing our low back pain improvement plan. So we're pretty excited to get this off the ground. So this is something that's been developed by myself and Dr. Lockie Chisholm, who is also at Total Balance Healthcare. It's essentially a 6-week, really comprehensive and thorough program for low back pain. So because of the length of time, and we've got a lot of modules in each week, we're able to really delve into some more deeper levels of understanding, I suppose, of each topic, which is really helpful. Obviously, we've touched on a few things today on a superficial level, but yeah, with the modules throughout the 6-week program, we're really able to dive into, all the little nitty gritty parts and pieces. So let's show the different modules. So this gives you an example of what is part of the course. We've got stacks of content. So this is just 1 week. As you can see, week 1 through the course, we cover all things from, a Pilates program to rehab exercises to education. So as you can see, we do a lot of modules on anatomy and different conditions, and a little bit more detail on those kind of things. We do some nutrition-based work as well. So you'll get meal plans, and you'll get different tips and ideas on how to be able to reduce inflammation and do all those kind of things that can help your pain as well. We've got clinical Pilates that Beck runs throughout the 6-week program as well. Some rehab programs as well on top of that. So as you can see, it's super comprehensive and really thorough, and can really help, build that toolkit, I suppose, for people to be able to manage their pain effectively. And the best part is it's all at home. It's all digital and virtual. So that's really helpful as well. We wanted to go through a webinar offer today. So you've made it through our webinar today. So we wanted to congratulate you and give you a bit of a reward for doing that as well. So we're starting off with the 6-week program. It's going to be running at $250, but for today, with the webinar offer, we're offering it for 50% off. So $125. That's going to get you 6 weeks of all the course content that we've gone through earlier. You're essentially getting 2 qualified osteos that are going to walk you through 6 weeks of modules and really help you develop those skills to be able to get on top of your back pain. So $125 for 2 osteos for 6 weeks is a pretty good deal. There's a code word there on the side, which is back pain, which you can use. You can follow our link there at the bottom. So that'll take you to our website. All the online courses are there. So the current one now is the low back pain improvement plan. Click into that and you can sign up using that code, and that'll give you the 50% off automatically. So awesome offer, and it's only going to be running for a short period of time. So I suggest getting into that quickly if that's something that interests you. But again, yeah, super valuable and yeah, really good offer. So
such a bargain with all the stuff that's in there and all the rehab and having access to you in the private Facebook group as well. It's a bargain. That is a bargain for what's in that course.
Yeah, that's something I didn't mention as well, actually. Yeah, the Facebook group really helps. So all members that take on the course will be involved in our Facebook group where we'll do weekly live sessions as well. So you're not only getting the digital and virtual content that'll help you through that 6-week period, but you always get that chance as well to ask us questions and really tailor or personalize your experience in the program as well.
Absolutely brilliant.
Yeah, cool. So that's the offer there. So yeah, you can follow the link down at the bottom there. Just plug that into your browser, and you'll be able to use that code word to finalize that purchase.
And we'll see you in the course.
Yeah, see you in the course. Again, any questions at all about today's webinar, then you can always reach us through here or follow our website or give us a call at the clinic. Thanks very much.
Thank you.